Welcome to our session today titled In Our Own Voice, the Intersection of COVID, Racial Trauma, and Mental Health. I'm so glad that you all are able to join us today and join the Healy Summit. Such a wonderful opportunity to share our voices and share our important work. My name is Kerry Graves, and I'm the Executive Director of the National Alliance on Mental Illness, Metropolitan Baltimore. So we are the local affiliate of NAMI, serving our community in Baltimore City and Baltimore County. NAMI is the nation's largest grassroots mental health organization. We offer education, support, and advocacy services to help improve the lives of individuals living with a mental health condition, as well as their family members and our communities. All of our programs are non-clinical services designed to complement the behavioral health care that each participant is receiving. All of our classes, support groups, and public presentations are peer-led, and you're going to hear from one of our amazing volunteers, Tevis, in just a little bit. And these are trained volunteers with lived experiences, so they understand mental illness firsthand because they have been there themselves. They use their own experiences to help our program participants work towards recovery. So I am going to just set the stage just a little bit and give you all some information on mental health, how it has interacted with COVID and racial trauma, and then shortly we'll be turning it over to Tevis to share some of her story as well. Okay, so first up, what is mental health? Well, you know, we all experience emotional ups and downs throughout our lives, but mental health conditions go beyond these emotional reactions. A mental illness is a medical condition that affects a person's thinking, feeling, and mood, and they are medical conditions just like any physical illness, such as diabetes or asthma or hypertension. So we shouldn't treat the head as separate from the body. These are all medical conditions. It's important to note that mental illness does not discriminate. It affects people of any gender, race, age, religion, sexual orientation. And each person living with a mental health condition will have a different experience, even people living with the same diagnosis. What we do know is that with effective and timely treatment, recovery is possible for all individuals living with a mental health condition. And mental health conditions are common. 1 in 5 adults in America live with a mental health condition, and this number is certainly on the rise. We have seen this exacerbated through COVID, and we have seen this number on the rise dramatically. And the need for mental health care is overwhelming. There are many barriers to seeking treatment, including parity issues that affect access to treatment. But overall, stigma continues to be a major barrier that prevents people from seeking treatment. We know that stigma can have real consequences. In the past year, only 41% of people living with a mental health condition received treatment services. And media and public perception continue to perpetuate this myth that those who have a mental illness are dangerous, even though large-scale studies have shown no difference in levels of violence from the general population. People with mental illnesses are actually more often victims of violent crimes than perpetrators. And so what we're here to do today is to speak about mental illness because that helps to educate and dispel myths. So what you're doing today by educating yourself on mental health conditions and helping us to spread the word that these are common conditions and that these are treatable conditions is very important. If you are out there today in the audience and you've got some questions, I encourage you to chat those into us, and we'll save some time at the end for a Q&A. And I'll have some questions for you, and Tevis will have some questions for you along the way. So please be as interactive as possible with that chat function as well. And so my first question to the audience is, have you ever heard someone using stigmatizing language? Or perhaps you've used it yourself. I know that I have found myself numerous times saying, gosh, that is so crazy, or she's really acting crazy today. Chat in some of the terms that you might have heard that might be offensive to someone who is living with a mental health condition. And let's share some of those words that we might be using every day that might be stigmatizing. See if we've got anyone chatting in right now. I'm not seeing any activity there, but you guys feel free to use that chat box. So let's talk a little bit about mental health and race. NAMI estimates that Black Americans are 20% more likely to be diagnosed with a serious mental health issue than the general population. And Mental Health America, MHA, estimates that 8.9 million Latinx or Hispanic identifying people in the United States are diagnosed with a mental illness every year. We can unfortunately also correlate these stats with higher suicide rates in those populations. And only 1 in 3 African Americans who need mental health care receive it. And why is that? Well, there's a history of distrust of the healthcare system, an understandable history of distrust. There's lack of insurance and access to care, a mental health stigma. We talked about that stigma that may be preventing individuals from seeking care. There's a lack of provider diversity and cultural competence within our healthcare provider system. So we certainly need more Black healthcare providers, more Black psychiatrists, psychologists, and providers. There's an inadequate support for mental health service in healthcare and insurance safety net programs. And of course, discrimination as well. We do still see discrimination when it comes to individuals seeking healthcare. And mental illnesses often present as physical ones, which can make it incredibly hard to recognize and to diagnose the symptoms. And so, it is important that we are always talking about what some of the common complaints might be that are associated with a mental illness. And I won't read through this full list that you're seeing on your screen, but being fatigued or feeling tired, migraines, abdominal pains, having trouble sleeping and changes in appetite, all of these things, which can be associated, right, with other conditions as well, could be a mental health condition. And if you are seeing these symptoms last for longer than 2 weeks, then it might be time to seek assistance from a medical professional. So let's chat a little bit about mental health and COVID. My goodness, I think we're all sort of hitting a pandemic wall right now. We've all held in there for this long. We've been taking care of our work and our family and our friends, and we've held strong through this whole pandemic. And I think everyone is hitting a little bit of this pandemic wall where we are starting to feel like maybe we are wearing thin on how long this has lasted. And, I think it's important to note that it is common to feel stressed or anxious during this time, but it may be especially hard for people who have already managed feelings of anxiety or emotional distress. And so, talking about some of this is really important during this time. And again, while it may be normal to feel this way, there are times when it can be more. If it's disrupting your life, it could be a disorder. Occasional worry is normal. Chronic worry is not. So again, I encourage you to seek help from a provider if you are feeling like this is becoming disruptive, if you're having symptoms that are becoming disruptive to your life. We're all experiencing some of that loneliness during this pandemic, and studies have shown that loneliness is correlated with certain diseases, and that's under normal circumstances. So this is certainly taking a toll on our health overall. And COVID in racialized communities can have an even bigger impact. Prior to COVID-19, the United States was in the midst of a mental health crisis due to increased demand with insufficient response. And the pandemic has worsened this issue. History proves that severe illness and death rates tend to be higher for racial and ethnic minority populations during public health emergencies than for other populations. People living in densely populated areas, low income and public housing, and multi-generational homes have trouble with practicing social distancing. And so all of this can lead to higher rates during this pandemic. And racial trauma has a negative impact on someone's mental and physical health. So when we think about hate crimes and job discrimination and pay inequity, systemic racism, which includes health disparities, microaggressions, all of this trauma can potentially lead to post-traumatic stress disorder. Psychological stress can often lead to physical problems, hypertension, heart attacks, diabetes, and obesity, for example, all of which disproportionately affect Black people. And so we are now defining these effects of COVID along with the community unrest stemming from years of pervasive racism as a dual pandemic. And so we've really got these two things going on that are compounding our communities and really are leading to a deeper issue and one that we're going to be overcoming for some time. I mentioned that NAMI is largely volunteer-led, and so we've got a steady group of volunteers, over 200 volunteers, that lead all of our programs in the community. These individuals are incredible. And I get the pleasure of introducing you all to Tevis Simon today, who is one of our amazing volunteers. And I will just say that she is one of the most resilient human beings that I know. And so you all are going to love hearing from her today. And as she shares her story of mental health and recovery. So Tevis, I will turn it over to you. You good, Tevis? Oh, now you're muted. If you can unmute. We can't hear you, though. Apologies, everyone. We will, Tevis's. Tevis, I can hear some background noise there, but we can't hear your microphone.
Any better?
Ah, there we go. Now we've got you.
All right. My apologies, everyone. Oh my gosh. My apologies, everyone. I'm so glad to be here. Turn this video on.
There we go. You're on.
All right. Hey, everyone. Thank you so much for joining us for our presentation today. As Kerry introduced me briefly, my name is Tevis Simon, and I've been with NAMI since 2015. I love volunteering. I am a community advocate. I participate in several civic committees and organizations. I am a mother. I am a grandmother. I am a friend. I am a spiritual being having a human experience. And you notice I have not stated my diagnosis because my diagnosis does not define me. So before I go into that, I want to share a little bit with you about what racial trauma, mental health, and COVID has looked like for my life. So how I'll do this very briefly is what happened, what helps, and what's next, just to kind of break down the story. And of course, as Kerry mentioned, please feel free to chat in those questions, those comments, and those concerns. We definitely want this to be as interactive as possible for the brief amount of time that we have with you today. So I'll get started. For me, I was born and raised in Baltimore City, West Baltimore, and growing up in the 80s, it was a very different time. The racial trauma for me was different as a little Black girl growing up in a project because what I thought we had and how I thought we were perceived was a stark reality to what people really thought of us. And I'll elaborate. So in the community, I mean, life was all about the frozen cup lady house, the penny candy store, some jelly, some flip flops, having fun with your friends and making sure you came home before the street lights came on. But it also involved addiction and homelessness and poverty. But these were the things that as a child, I didn't know that we really lived in. I thought everybody lived like this. I thought everyone had to endure addiction. I thought everyone had to endure yelling and fussing and cussing and seeing women beaten and banged on by their boyfriends or husbands and things being stolen or sold out of their homes for narcotics. Like, I honestly thought that that was how life was because that's how everyone around me lived. So we coped, we survived, and we made the best out of it as children. Now, when I recognized that we were seen, and when I say we, I mean those of us that lived in Lexington Terrace projects, in Murphy homes, in impoverished neighborhoods that we didn't think were impoverished, but we knew something wasn't right. When we would go to resource centers, when we would go to government offices, that's when I remember being made to feel like I was less than. That's when the stigma and the blight of being a Black person living in an impoverished part of town really put out your business card before you were able to even introduce yourself. Being with my mother, being with other Black women in the community as we would go to get the free government cheese, okay, to get the powdered milk. We saw the stark differences in how we were treated and how we were welcomed by others, opposed to how we connected in the community. So as a young child, I recognized the difference of how people live down near the Inner Harbor in comparison to how they live in West Baltimore and on Pennsylvania Avenue. I saw that difference. And as I continued to grow, naturally, it affected my mental health. I'm seeing all these same things. I'm seeing all these contrast, vast differences of what my community is, what we feel it is, and what the world really sees it as. So I'm continuing to grow, and I'm also seeing addiction. My mother, unfortunately, succumbed to a heroin addiction, and that's what took her life. I've seen friends of my mother also follow that same path. And growing up, you think that this is what life is. So it affects your psyche, it affects your ability to really understand that there's more than one perspective. Also, during that time, my whole idea of what mental health and what mental illness looked like was dictated by the community. The same community that was neglected systematically, that was not treated fairly, also had to deal with how to survive with an addiction. So trying to understand why I was living in the 80s, where I saw all of these commercials that said, don't do drugs, and living under the Reaganomics of that time, President Reagan being the president, and not understanding how I'm seeing these commercials that say, don't use drugs, but everyone in my community was addicted to something, and there was no help for us. So again, that left trauma. And then as you continue to grow and go, you recognize that there is a big difference in the life you live and the life that you could be living or that you should be living. But systematically, this is what it is. And that's what it was for me growing up during that time. So seeing all of those things, recognizing the stigma, at times literally being told growing up that, I'm cute to be dark skinned. I remember people from other nationalities saying to me, you're such a cute little Black girl. Can you imagine how that feels when you're 6 years old, you're 7 years old, you're 8 years old, you're 10 years old, and you're wondering why you can't just be pretty? Why do you have to be pretty to be dark skinned? So the racial trauma, the mental health of it all was very, very heavy. So that's a little bit about what happened. And I'm going to bring you to present day. So what I want to ask and open up the floor as I'll do until this segment is over, is there anything that any of you have experienced in your life where you recognize the stigma that was placed on you, your family, your community, or even your neighborhood? How did you work through that? Is anything that I'm saying resonating with you in any way? And if so, please feel free to type in and chat. The next part of this whole journey is what helps. What I've recognized is that with everything that I've experienced growing up in West Baltimore during that time, living with a mother that was battling her own demons, and again, addiction, took her life, seeing so many of my friends who had mothers just like I did, and we would bond together and laugh together and just make the best time out of life that we could, because we knew when we went home, we didn't know what type of mindset our parents would be in or what our house would be like, so to speak, the temperature, the energy of that. So what I've learned and what has helped me going from that place as a young girl to this place has been acceptance. Acceptance is the major, the pivotal point for me in my life, where I recognize that acceptance doesn't mean that I am everything that I saw. Acceptance doesn't mean that I too will be a heroin addict and die of a heroin overdose. Acceptance means that this is who I am, this is who my mother was, these are my people. And through that, I am learning how to be better than they were because that's what they told me. That's what helps me to be better. Before my mother transitioned on, she said, I want you to be better than me. I remember being a little girl going to school and coming home with certificates, and everybody in the neighborhood would say, I want you to be better than me. And it wasn't because they knew or felt that they were less than, it was because they knew that it would be the next generation to take it further, in spite of the systematic oppression, in spite of the blight and the stigma, in spite of all of that. So accepting who I am and whose I am, amen, has made all the difference in my life. What also helps me, I don't know if any of you saw, is the pooch that I picked up on my lap. He is my service animal. And I take him as many places as I can, and he helps me a great deal. Another thing that helps also is being what I needed during those times of hardship, of trauma, of drama, of hell, being what I needed, being that for myself and being that for others as well. So being empathetic, being understanding, just shutting up and listening, right? Because everyone doesn't always need your opinion or your suggestion. Sometimes we just need someone to listen to us with their whole heart and not listen, just waiting to reply. So I do my best to be what I needed for myself during that time, and to be that for myself and to be that for others. What also helps me is doing these presentations, having honest, transparent conversations about my journey, about my life, about even where I am now, and encouraging others that we deem as leaders and people in positions of authority. I encourage them to share your truth, be transparent, because that's when we begin to really open up and have more real conversations and have healing in our city and this country overall. Another thing that helps is maintaining healthy boundaries. If I can't do it, I will let you know that I can't. And if I can, I'll give you 150% of my time and dedication in that. Lastly, with the last segment is at 11:37, and I'm making great time, is what's next. I shared with you what happened. I shared with you what helps. And the last segment is what's next. And whenever I get to this segment, I get really emotional, but it's good emotion. Because if anyone knows anything about life, and we know that everything that we think we know, we find that we know nothing at all. So all of these great ideas I had for my life by the time I got to this place in my life, God has truly superseded all of that, even through my struggles, even through the trauma. God has blessed me abundantly. So what I will say is what's next for me is everything he has for me, everything that is good, everything that is awesome, everything that helps others and heals others. So I hope that you will support me when you see me on your TV screen, on your cell phone, maybe in your ears, on the radio. Media is my next move, because I think it is incredibly important that we have these conversations and not do things to cope, but to really heal. So I thank you for your time. I jumped from what helps and I went to what's next. So great. I did that, but more than that, though, I still want to open up the floor for questions. So I want to know what helps you. How do you go through the things that we've all gone through? You know, one of the things I forgot to mention in this whole three-part was the COVID part. The COVID part of everything has been the heaviest, because involuntary isolation during COVID is a real thing. Involuntary, let me be clear, because I don't think after a year of all of us, no one is really volunteering to be alone at this point. So involuntary isolation creates a lot of things. And I will say with COVID, it has caused some triggering emotions for me from my past that I've had to deal with because I've been alone. And it has also caused me a great deal of pain emotionally, to see that those neighborhoods that I've grown up in are still plagued by the same poverty and systematic neglect. So what COVID did, in my opinion, was make was it basically made communities that were already lacking what they needed in a more destitute, left them in a more destitute position. And for those of us that have been able to migrate to other parts of the city and other parts of this life, I think COVID still has, in some way or another, triggered some things within us to take us back to our childhood, to take us back to those uncomfortable things that have happened to us. But COVID has also given us an opportunity to really deal with those things and, again, create and maintain healthy healing mechanisms and not just to cope. So that is my spiel. I hope you guys have some questions or some comments. I saw the chat box lighting up.
Yeah, the chat box is lighting up. So we do have time for questions. I'm going to go through just some quick resources for you all. Get this presentation back up on the screen for you, and I will go through some quick resources. I do want to mention that our volunteers are trained in sharing their story and also trained in answering your questions, and they are really open to all of your questions out there. So please don't hesitate. If you have questions for Tevis, if you would go ahead and start chatting those in, we will have time at the end here for her to address those questions. And Tevis, thank you for your bravery and sharing your story once again on behalf of NAMI. You are incredible as always. So you guys will hear from her in just a bit as she answers our questions, but I do want to get to just a few resources here. Tevis just talked about her experience with COVID and how she is feeling. I think all of us are feeling this way. We don't have control. We've got financial concerns. We're still grieving that loss of normal, even 11 months into this. And the more we talk about it and the more we share our stories of how we are feeling in this, the more we will feel that we are not alone as we go through this. And so what are some tips and strategies for managing your mental health? Taking breaks from news consumption. It's generally a good idea to stay engaged and informed, but it also is a good idea to set your limits, right? Make sure you're getting your news from reputable sources and that maybe you're limiting the time that you spend. I know for me that especially at the beginning of the pandemic and especially as the election was happening, that the amount of news that I was consuming was not healthy for me. And I really had to start to set time limits for how long I would be reading news every day. Make sure my CNN alerts weren't going off on my phone all day long, and maybe take some breaks from how much, because listening or reading the news constantly can increase stress. And so maybe setting a 15-minute limit for how long you are on social media or reading the news. Sticking to daily habits and routines really can help manage your mental health. And so if you before the pandemic got up at the same time every day, continuing to do that, getting up at the same time, going to bed at the same time each day, and really creating some boundaries for yourself between work and home life. Taking care of yourself through exercise is incredibly important. Research suggests that when we exercise, our brain releases chemicals that help us better manage stress and anxiety. So finding those little ways to move throughout the day is incredibly important. And there are some free apps out there for meditation and mindfulness, which can be incredibly helpful right now. So I encourage you to check out some that we've got listed here on the site as well, as those have been proven methods. And then what can NAMI provide? So we provide support groups, both support groups for individuals who are living with a mental health condition, as well as for family members or caregivers of those with a mental health condition. And so those support groups, again, are led by individuals who have been there. They are led by our volunteers who are either living with a mental health condition or are caregivers to someone who does. And so they are giving their personal experience. Our support groups have been virtual since the beginning of the pandemic, and they continue to be virtual today. So you can join us online. We've got the schedule up here, but also please feel free to visit NAMIbaltimore.org to visit the full schedule and to register for our support groups. And then we operate a helpline Monday through Friday from 9 to 5. If you're looking for additional resources, if you need help with housing or legal aid or any other resources in the community, then you can call our helpline, and either our staff or our dedicated volunteers will answer, and will be able to help guide you towards resources in the community, or answer any questions about our NAMI classes and programs that we offer throughout the community as well. And this is important to note, is that our helpline is there as a warm line to help you with resources and services. But if you or someone you know is in a crisis or needs immediate assistance, you're going to want to contact your local crisis hotline. And I've put the Baltimore City and Baltimore County hotlines up here on the screen. Mobile crisis teams can meet you at your home and can provide assessment and intervention. And so always keep those numbers handy for yourself or for someone that you love. Okay, so I am going to exit out of the presentation here and get Tevis back up on the screen and see if we've got any questions in here. We do. We've got questions for you, Tevis. Okay, so
Awesome.
Bear with me, y'all, as I scroll through here. And you guys have provided some great commentary on here, and I might want to read a couple of those as well, because I think there have been some excellent things. Rakia has said, people always tell me that I speak so well or that I'm so professional. If I've had a 20-year professional career, is that not what's expected? Society paints a terrible picture of us. It's hard to be looked at and automatically judged. It's impossible to scrape away. And Tevis, you and I actually had a conversation about that, I think, just last week. And you were expressing some of those same sentiments to me.
Absolutely. Absolutely. And thank you so much. What was her name? Rakia?
Rakia. Mm-hmm.
Rakia, thank you so much. And we share that in common, because I also heard that growing up, and still today. It was a combination. And I remember I would cry to my mom, because I would ask her, what does it mean that I'm pretty to be dark skinned? And why do people compliment me on how well I speak as if I'm not supposed to, mommy? And I just remember she would just grab me and hug me and tell me that, unfortunately, there are people that think because of where we live and how we look and the color of our skin that we're not as intelligent. So it is even more important that you speak well, that you conduct yourself in a manner that you represent your family. It's not about impressing white people or purple people. It's about representing who you are and your family. So that's, yeah, I definitely, whew, that is so not a compliment, people. Please put that on the blowhorn. You speak so well. Chris Rock even said that. You speak so well. That's not a compliment. Stop saying it. Put me on a meme. Shucks, it's not a compliment. Thank you, Rakia. It's not a compliment.
Not a compliment. Tevis, this is important. You've been asked, what do you do on a regular basis for self-care?
Oh, okay. So I journal a lot. I journal, like, and Kerry and I before we did this, I showed her like 3 papers of the rough draft of the presentation today. And I still felt like I was a wannabe rapper trying to freestyle. But journaling, it works for me. And I've gotten into meditation, y'all. And I'm telling you, I know somebody right now, like, meditation. I know, I rolled my eyes too, or I should say, however, it really works. And the title for me with meditation has been the guided meditation. So I intentionally seek out guided meditation, because, with meditating, the goal is to release the thoughts and release the tension, and just to allow yourself to just go and flow, and to breathe in your nose and out of your mouth, and let that belly hang low and just let it go. But sometimes there's so many thoughts going on in your head still, and then maybe your environment is not conducive to that. So what I've found is finding guided meditations on YouTube, on apps. Did I say YouTube? It's not an S on the end of that, sorry. YouTube, and your Android Play Store or your iPhone apps, but that has really helped. And also, y'all, I go walking and exercising every day. Black girls run, Black girls walk, Black girls are not afraid to sweat their hair out. So that is something else I do for self-care. And also my diet. I've changed my diet. Long life and longevity is important to me. In spite of what we see on the news, heart disease is really a leading cause of dying for us. So that's been my self-care.
That's great, Tevis. Thank you. Another question for you. How do we keep from falling into our own heads?
Let me see. How can I say that so I don't sound like a therapist? Because we don't want to sound like that, because sometimes therapists say stuff to us and we like, boo, I don't want to hear that. It's easier said than done. But to be honest with you, going back to the journaling, and I'll tell you why. I get up in the morning and I read that it is normal to have a level of anxiety in the morning. We all have it. Those of us that are diagnosed and undiagnosed with anxiety disorder, doesn't matter. We all wake up with a sense and hint of anxiety because the day is about to start. So what I recognize is that for me, my anxiety is not just like maybe a minute or two. My anxiety can take me through a full 24-hour day. So when I recognize that my thoughts are going from something positive and optimistic, I literally recite affirmations. So again, I know that sounds corny, but when you wake up and you are faced with the thought of everything that you're not, like literally staring back at you, it is important that you affirm who you are, that you are prosperous, that you are living in abundance of everything that you need, that you are worthy, you are enough, you are optimistic, you are motivated. And trust me, y'all, there have been mornings where I've gotten up with tears coming out of my eyes saying, I am optimistic, I am motivated, I am loved, I am loved. Like I am a child of like pushing through, because every day is not a good day, especially in this current climate.
Yeah, absolutely. And being so honest about that with those around you. If you're not having a good day, it's okay to say this isn't a good day. And you know, I think we've all sort of gotten conditioned to the how are you doing today and just answering so quickly, oh, I'm fine, and then going about our days. But even more so, I think during this pandemic and this time, it's even more important to answer honestly. And
yeah, it is.
Yeah, having a rough patch, then say it and you might be freeing up the person on the other end of that phone or video call to say some of their feelings too, because I think we all just tend to bury and hide it.
Absolutely. And I want to share one last thing with everyone. We all get phone calls or maybe text messages from friends, family members, where we can kind of feel the energy where they need someone to talk to, or they may even text you or call and say, hey, I really, really, really need to talk. I need somebody, like I need to talk. And you may be having the day or moment where you're like, I can't. You are the friend or the confidant that's always listening and giving advice or suggestions, and you give it with love. You don't give it grudgingly, you give it with love. But this particular day, this particular moment is not a good day for you. So this is what I encourage you to say to those friends and family members, and say this with love. You can say it in a text message. I know that you need me, but I need me more today.
That's a great point, Tevis. That's absolutely a great point.
I know we got folks that's always like, but. That's where the healthy boundaries come in.
Yeah.
What helps? That's where the healthy boundaries come in. And I'm going to say it one more time. I know that you need me, but I need me more today.
Yeah.
And put a heartbeat, and put a little heart beside it.
You know, we've got another NAMI volunteer who always says, check in on your strong friends. Right?
Yes,
always check in on your strong friends, because just because they're strong doesn't mean that they don't need you too. So check in on your strong friends.
Absolutely. So if any of my friends are watching this, check up on the queen. Check up on me.
There you go.
Yeah, please check up on me. I ain't too proud to say it. Check up on me.
So we've got a question here. What are some ways to expose these stories and resources to students in our schools, many of whom are dealing with a lot of forms of trauma? And I do want to mention that you can reach out to us at NAMI Baltimore. We have a program called Ending the Silence. Ending the Silence is a school-based program that gives presentations for students, for parents, as well as for teachers. So 3 different presentations. They are, again, peer-led by individuals like Tevis who have lived experience. So there is a youth presenter that will share their story of growing up with a mental health condition, what it was like for them in school, you know, how they managed their mental health condition through school. And then our other co-presenter will give some of those tools and resources for students, parents, and for staff, teachers, on how to navigate mental health conditions, how to navigate the school system, how to recognize those signs and symptoms in your child, and how to speak openly and have those open conversations. Again, you know, I think a lot of this is making sure that everyone is comfortable speaking up about mental health conditions and treating them just like a physical health condition, because largely the problem is just not being open to conversations. And so you don't want a student, you know, burying their feelings and not talking about the emotions they might be having. And so trying to reduce that stigma and open the lines of conversation and break down some of those walls is exactly what the goals of Ending the Silence are. So you can reach out to us at info@namibaltimore.org, and we'd be happy to share the Ending the Silence resources with you. And similarly, there was another question about what are some ways to support educators and families as they return to school, and we can provide some of those tools and resources too if you reach out to us there. And I will place that that address into the chat. Let me get into the chat for everybody. That is going to be info@namibaltimore.org. And you can just email us and we will get that out to get information out to you. That's a free program, I should say. So if you are, you know, looking to bring that to your school, if you're an educator, you can reach out to us and we will schedule that for your school. If you're an after school program or out of school program, we've done these programs for out of school time programs, and we are doing them virtually right now. So we can do that for, you know, if you're doing one of these pod programs out of school or something like that, we can do them for your health education class in school. Parents for the PTA, we're happy to come in and do them for a PTA meeting as well. So do reach out to us. We would be happy to come in because, again, it's having these conversations and making sure that we are constantly talking about mental health is what's important. Looking at the chat, I'm not seeing any other questions in here. Tevis, any final comments from you to close us out here today?
Yeah, I will say, I'll say a couple things. That's two, so I'm gonna narrow it down to two things. One, I would like to encourage all of my professionals, my caregivers, my teachers, mental health professionals. You're a regular human being with wailing arms and legs, like please reach out to the resources that are available. I have tons of friends and associates from different walks of life. And I know the stigma that is placed on us when we become a professional and we're also dealing with our trauma. We're not necessarily comfortable going to a public support group. We don't want to jeopardize the professional reputation we have and what we've worked hard for. And I understand that. But when you think about that on a deeper level, there lies the stigma. So how do we eradicate the stigma if we continue to live behind it? So I encourage all of my leaders, my professionals, the folks that people go to for the help, please get what you need. Because I don't know about your mama, but my mama used to say, you can't help nobody unless you help yourself. So, I mean, there's no such thing as no healthy boundaries. If they don't understand, then you might need to pick some new friends. We got one life, one. And we have to do our very best job to live the best life that we can, and also be empathetic enough to know that our brother or sister could be going through something where they need our support, but designate how we support so that we're also being able to take care of ourselves. Okay, so don't put too much in someone else when you have nothing left for yourself. So everyone, reach out to us, free for the low cost of $9.90 nothing. It's $0. It's for the support group, for us to come to your school, for us to come to your community center, for us to come to your church. We have to start talking about this. I want bishops, pastors, I want clergymen, I want the deacons and the deaconess, I want the mama of the church. I want everybody to have the conversation about mental health. We have to break the stigma. We are beautiful Black and brown people. Okay, and we have no reason to be ashamed of anything. We had 400 plus years of struggle. It's time for us to get that thing out and progress. Amen. So that's all I got to say.
Thank you so much, Tevis. You are an inspiration to us all, and we appreciate your time today. And thank you all for joining us for this important conversation. You're helping us break the stigma by listening to this, and I hope that you will share our information and share this recording when it comes out with others so that they can learn as well.
Thank you. And thank you to our moderator. Thank you to HCB, my committee. I love you guys so much. HCB on 3. So thank you all. Have a fantastic day and weekend, everyone. Thank you.
Thanks all.